Welcome, my friends, to Dr. Frank Cutting Edge Medicine. I'm your host, Dr. Frank Miller, coming to you from San Antonio. Well, we made it to the end of the month. We had the power outages, freezing pipes, runs on gas and groceries. It's nice to be getting back to normal. Spring is right around the corner. It's time to get happy and watch for the rebirth of the land. Trim out the old, make way for the new growth. And it's Lent, a time for our own self-evaluation, time to discard non-productive habits and prepare for our own rebirth and growth. And so we start with our prayer. God, our Father and Creator, thanks for the rebirth of springtime to remind us to cast aside our unproductive ways and to start new habits, to always see the best in people and work together in harmony. In your holy name we pray. Amen. Well, I got several topics to talk about today. First, with the freeze and everything, we're going to talk about water and we're going to talk about fractures. But I want to remind everybody that this cast is sponsored by O3 Plus Texas. That is our health and wellness clinic here in San Antonio, Texas. Our nurse practitioner there is Kim Engelman, family nurse practitioner. She helps run the show over there. The website is o3plustx.com, o3plustx.com. And our phone number is 210-558-7778. Things that we talk about relating to ozone are not FDA approved, and they are not designed to diagnose, treat, cure, or prevent any particular disease. But we'll talk about a lot of different things today, and one of the things we're going to talk about is pulsed electromagnetic fields, which are FDA approved to treat some conditions, which we will go into. So from this recording, if you need to address or to look up some of the different things we talk about, the website for this show is www.drfrankcuttingedgemedicine.com, DRFRANK, cuttingedgemedicine.com. And we'll have a bunch of links there so that you can just push on a button and find more resources for the things that we talk about. So let's go back to the freeze. We had water. So as you know, water, generally, we were always taught that there were three forms of water: solid, liquid, and vapor. But I've been reading a book recently that talks about the fourth form of water, which is called exclusion zone water, or EZ water. The book is called Cells, Gels, and the Engines of Life by Dr. Gerald Pollack, Pollack. And we'll put a link to that on our website, and you can purchase it on Amazon, or I don't know if it's on Kindle and whatnot. It probably is. But the interesting thing about this form of water is that it's more structured, it's thicker, more like honey, and we make it. We make it naturally. It actually is one of the things that helps the mitochondria to do their work of producing energy better. So we talked about mitochondria before. That's really what it's all about with everything that we're trying to do in our ozone clinic and with our general pillars of good health, which, as you recall, are good sleep, good nutrition, regular exercise, detoxify, and de-stress. All those things are so that we have enough energy to rebuild our bodies, to have good immunological systems, to protect ourselves from infections, from COVID, from cancer, and to rebuild any cells that need to be rebuilt. And then what's left over is how much energy we have. So we talk a lot about having enough energy to do the things that you want to do. And as we get older, that's one of our biggest problems. And again, we had talked before that it was due mainly to oxygen utilization. And what is it that helps with oxygen utilization? That's your mitochondria. So the mitochondria use oxygen to produce energy. So here we have another way to help your mitochondria produce that energy. We want to make more easy water, exclusion zone water, in your own body. And according to Dr. Pollack, some of the things that make it is sunlight and infrared light and vibration. So right now, as springtime is happening, this is a great time to get out and do some walking in the sun. If it's nice weather, have some shorts and a t-shirt on or whatever, and get some good sunlight into your body. And that will help your own body to create more easy water. And you should have more energy from that, because the mitochondria can use that easy water and make energy more efficiently. The second thing was infrared light. And we talked before on a previous show about saunas. And hopefully, if you didn't get one, you can still get one. We'll put the link up again. If you use our webpage, the drfrankcuttingedgemedicine.com, you can get $75 off of the sauna that we had promoted before, which is from Relax Saunas of Momentum. It's about a 3-foot square tent. That's the foot plate of it is anyway, so you can put it just about anywhere. And then it's you just sit in it. It's got a very comfortable camp stool type thing with a back in there. And you just drape a towel over the back of it and turn the sauna on. And we talked before about the health benefits of sauna and how it decreases overall mortality if you use the sauna at least 4 days a week for at least 20 minutes each session. So now we know partly why that may be happening, because the sauna has infrared light, and that's going to create more of the easy water. And the easy water will help your mitochondria to make more energy, which drives all the important things that we talked about to help you stay healthy. And then the next thing that I want to talk about, which we haven't talked about before, is vibration. So we got a new gadget in the ozone clinic probably a month or two ago. And those of you who know Dr. Schallenberger or maybe get his newsletter, he's talked about power plates before. And a power plate is an apparatus that you stand on, or you can sit on it, or you can do all kinds of different exercise on it. But it basically is a vibrating plate. And I have several patients who claim that being on that gives them a whole bunch more energy, and you don't even need to be on it very long. Sometimes what they do is just get some light dumbbell weights and they do the exercises while they're vibrating on that plate. Depending on your balance, you have to hold on a little bit so you don't fall off. You can adjust it for amount of vibration. You can adjust it for time of vibration. But now again, we know why that's probably helping these people, because vibration increases easy water, the exclusion zone water. And that water is better utilized by your mitochondria to make energy. In an upcoming session, we're going to talk about another thing of water called deuterium depleted water. Basically, water is H2O, hydrogen, 2 hydrogens and an oxygen. But an isotope or a different form of hydrogen is deuterium. So hydrogen basically has a proton and an electron. But the deuterium has a neutron in there. So a neutron has no extra charge, but it makes the water molecule twice as heavy. And as it turns out, your mitochondria don't do very well with heavy water. And naturally, it occurs in different concentrations in our water supply. So it's just one of the things that we have, that we live with. We have lots of toxins in our environment. This is a natural kind of a form of water that slows down your mitochondria. And in one of our conferences, it was very interesting because over in, I believe it was near Nepal, there is a group of people who live to be a lot longer than everybody else. They're living to be about 120, and they're drinking glacier water, and the glacier water has a lot less deuterium in it. So anyway, now there's a company coming into California who will be selling deuterium depleted water. So if you get rid of some of the deuterium and just have plain good H2O, your mitochondria function much more efficiently. In fact, they're putting in a plant that will make deuterium depleted water very close to UCLA. And part of what the impetus is that if you have a bunch of college basketball players who all have mitochondria that are working much more efficiently, you might be able to win more games. So, of course, there's usually a profit motive behind almost everything. I'm going to try to get one of the owners of that company to come on the show and tell us more about it. But anyway, there's always an economic part to it. But the other piece is if you have more energy, what they found in small studies, and these were not double-blind studies, they are observational studies over in Russia, actually, was that if you had deuterium-depleted water and gave that to patients, they had improvement in their cancer status, or they had less cancers. So those, it deserves more study. It's an interesting idea. And again, like we talked about with cancer a couple of weeks ago, cancer is very, very complex. One thing will not keep you from having cancer. One thing will not cure you from having cancer usually. So cancer happens when you have probably at least 10,000 mutations in cells. So that's why they're so hard to kill, because just as soon as you come up with some kind of a treatment, they selects for an even more resistant type of a cell. So again, the best thing for cancer is not to get it, and the best way not to get cancer is to keep your body functioning at optimum speed so that your natural killer cells can go out and kill any precancerous cells or abnormal cells that might be there. So anyway, and one last thing about the easy water. Another way to get easy water is by drinking bulletproof coffee. You may have heard me talk about bulletproof coffee. That was invented by Dave Asprey. So he's the guy that we talked about before who wants to live to be 180. And as it turns out, if you blend coffee with butter or ghee, then that actually helps your body make more easy water. So that may be why he felt so much better after he drank the bulletproof coffee. So that's all I want to say about water. The other thing that happened with water, and of course its solid form of ice when we had the cold snap a week or two ago, was people slipped on it and got fractures. So the fractures can be, obviously depends how hard you fall, whether you break a hip or whatever. As it turns out, my nurse slipped and has a hairline fracture of her elbow. So I said, hey, no problem. We will put a magnet on it. And of course, she was a little skeptical, and I believe the studies originally were done at A&M. What I'd heard in a conference, and I'll have to verify this, but they took a rabbit and they were testing the pulsed electromagnetic field, which is a pulsing magnet where it shifts on, off very rapidly. And it varies with the cycles per second how often it does that. So I think they were using about 10 cycles per second. And they took a rabbit forearm, and it was experimental rabbit. So they anesthetized the rabbit, and they took out a piece of his bone of the forearm of the forefoot rather, and did it on two rabbits. And the first rabbit, they put the pulsed electromagnetic field on there all the time. And the second rabbit, they just let it have usual care. And at the end of a month, the rabbit that had the magnet on it had a soft union across that entire segment, which I believe they said was a half an inch or an inch. I don't know. It was a long way. And the other rabbit didn't. He just had maybe a little nub of growth. So it was pretty impressive that it really improved the growth of new bone tissue across. And actually, we had a conference, I think about 4 years ago, about pulsed electromagnetic field therapy. And the teacher was Dr. Pollock, Pawluk. So it's interesting. We have two Dr. Pollocks on this show. Dr. Gerald Pollock was the one about the easy water. But in this case, it's, I don't know. This one is Dr. William Pollock, Pawluk. And he's the pulsed electromagnetic field expert in the U.S. So what Dr. Pollock, the magnet guy, had done, he was looking for some kind of data on magnet therapy, and found that over in Romania, they had done a lot of research on magnets. They were mainly using static magnets. So static magnets are like the ones on your refrigerator. They don't pulse off and on. And you've heard of people who put magnets in their shoes and they say that their pain gets better. You can wear magnetic socks and all kinds of different things. And you always kind of wonder if these people are truthful or if it's just placebo. But what he did, he went over to Romania and dug up all of their research. Of course, it was in Romanian language, and so he had to have an assistant there to help translate everything. So he wrote a book called Magnetic Therapy in Eastern Europe, a review of 30 years of research by Jiří Jerabek, that's Jerabek, MD, and William Pollock, MD. So we got a copy of that book when we were at the conference, and he was telling us about the benefits of magnets and how the static magnets are good and they work well, and that's what most of the data in that book was about. But actually, pulsed electromagnetic field worked better. So, how does a magnet help you to heal? The theory is that the magnet influences the charged particles in your fluid. And the beauty of a magnet, of course, is it can go right through your skin and deeper into your tissues. In fact, there was a Dr. Oz show from 2014 where he talked about pulsed electromagnetic field therapy. And we'll post that link on our website, www.drfrankcuttingedgemedicine.com. And you can go listen to what Dr. Oz had to say about it. And actually, this Dr. Pollock, the magnet guy, is on that show. But at any rate, so the theory is if you can get the charged particles into the nutrients, into the damaged area, be it a bone or whatever, then you should have better healing. Another thing that they notice that happens is when you have damaged, inflamed cells, especially like your red blood cells, they're supposed to all have a positive charge around them, and so they repel each other. And that's better because if the cells are individual, they can carry more oxygen to the area, and you need oxygen for healing. So when you get inflammation, a lot of times the red blood cells stack in a rouleau formation, they call it. It's like a stack of coins. And so it doesn't flow as well through small capillaries, and it just doesn't bring in the oxygen as well. So that may be one way that the pulsed electromagnetic field works as well, because it breaks apart those stacked coin formation, and you're able to get better oxygen and nutrients into the area, and that may be why it heals so well. Now, so after we went to that conference, we bought a very nice pulsed electromagnetic field unit, and we have it in the ozone clinic. So again, if you're having back pain, if you just had surgery, anything else like that, we can help you with that pulsed electromagnetic field therapy there in the clinic. But for healing a bone, like my nurse, it would be best if she could have the magnet on all the time. And so one of the things that Dr. Pollock has, he has reviewed a bunch of different pulsed electromagnetic field devices, and he does get a little bit of a kickback from that, so that's full disclosure. But he evaluates them and will tell you his opinion of whether or not they really work, whether they're worth the money. And then you can buy them on his website, which is www.drpollock.com. That's drpawluk.com. And again, I'll post that as well on our website, so you don't have to remember all this stuff if you're driving around and listening. So the one that we got, and we got a number of them, and it's, we got a number of these devices called Flex Pulse. So the Flex Pulse is a very nice portable unit. They cost about $1,300, and it's a rechargeable unit. So you're wearing something about the size of an iPhone, and that's the unit itself. And you can put it on around your neck. You can put it on your belt, wherever you want to carry it, on your waistband. And then it comes with instructions, and Dr. Pollock has put in instructions on which setting to put it on for whatever you're trying to heal. So usually for a broken bone, it's like setting 1 or setting 2, which would be the 10 cycles per second, or alternating 10 cycles to 100 cycles per second. And then you just put the pad, the magnetic pad, over your site wherever you have a broken bone. You can wrap it on there with, say, some Coban, which is that elastic bandaging material. You could tape it. We usually have people, keep it in like a Ziploc bag or something so that it doesn't get skin oils on there, and just tape it into the area. And you wear it until the battery goes down, which is typically about 4 hours on that setting. And then you recharge it and you do it again. And the longer you can have the magnet on there, the faster you're going to heal. I wanted to share another case study. So this was what a patient of mine who is a pole vaulter. He's about in his 50s. And about 2 years ago, he was around Thanksgiving, he was going over a ski jump at one of the a snow ski jump at one of the resorts, and he missed the jump and landed on his side and broke a bunch of ribs and especially his left collarbone in 4 places. So they had to make a little tray to put all the little broken bone pieces back in and have an operation to fix his collarbone. And when I saw him, I said, man, I guess that's the end of your pole vaulting days. And he says, no, actually, I think I'm going to get better. And I said, well, try this magnet. Let's see if we can get you healed faster and we can get rid of some of the pain. And he was very compulsive, which is good with this magnet. And he used it almost all the time. As soon as the battery went down, he charged it, he put it back on. And I didn't really hear much from him. I mean, he wasn't requiring any pain medicine, any additional pain medicine or anything. And then he sent me a text from the second week of January the next year that he had participated in a pole vaulting tournament in Florida and got second place. And that was 6 weeks after he had broken those bones. And, you know, pole vaulting, I mean, he's jumping up, I don't know how high he goes, it's at least 12, 15 feet, something like that. And then you land on a mat. I mean, that's a lot of stress just to be able to lift your body up over the pole and then to land on even a foam mat. And you can't have any broken bones if you had all that because that would hurt. So pretty impressive evidence that he healed in probably half the time. I would have guessed if I'd seen him and didn't have the magnet, I would have said you probably won't be completely healed for 3 months. And instead he was healed in 6 weeks. So that's a pretty interesting thing. And I wanted to share the information that if you have a fracture from the recent falls, if you can go visit our ozone clinic and we can rent these out to you. I had another patient recently who had a foot surgery, and I asked her if they put her on the pulse electromagnetic field to help heal the foot after the surgery. And she said, no. And I said, well, go ask your podiatrist. And the podiatrist said, sure, let's go ahead and do it. Well, we tried to go through her insurance and they wouldn't approve it. And they wanted her to pay $2,000 to have the magnet for the 6 weeks. And I thought that was kind of a ripoff because you can buy a brand new one for $1,300. So anyway, this is the state of affairs with healthcare in this country, of course. Everything seems a little more expensive than it should be or harder to get. So what we tried to do again with the ozone clinic was to buy a number of these units and we can rent them out to you. You have to leave a credit card so that if you happen to walk off with it, we're going to charge you $1,400 or $1,300 so we can buy another one. But, you know, most of our patients are very good. The ones who don't bring them back, they got well so fast and they just put it in a closet and then they forgot about it until they were moving. And then it's like, oh, we should bring this back to the ozone clinic. So nobody does it with malice intended, but we will call you if if it's been a couple of months and you haven't brought it back yet. So anyway, we have those available. The magnets, after about 4 years, we have to get them refurbished and get a new magnet. But I want to mention one other aspect of having these pulsed electromagnetic field, the flex pulse. I had a lady who had a big problem with insomnia. You know, she didn't do well with Ambien. She was too groggy in the morning. She tried melatonin. It didn't seem to keep her asleep all night. And one of the things that Dr. Pollack had said at the conference, the magnet guy, was, you know, at setting number 3 on the flex pulse, it does 3 cycles per second. Well, 3 cycles per second is very close to your delta waves, which we mentioned before are those very calm, peaceful waves that you get into with deep sleep. Those are the waves that you want to get into because that opens up your glymph channels in your brain, which helps your brain to get rid of all of its toxins that it's accumulated during the day. And again, those have to flow down through the spinal cord. So alignment of your spinal cord is important. We talked about that if you've got spinal issues, that's where a chiropractor can really help you out. At any rate, because the size of the magnetic field coming out of this unit is about the size of a basketball, you can turn it on at night. And because it's only pulsing at 3 cycles per second, it actually lasts 10 hours with the battery with this setting. And so she put the little magnetic pad under her pillow and went to sleep, and it captured her faster brain waves. You have faster brain waves when you're thinking. Your let's see, what is it? Beta waves, which is when you're thinking of more complex tasks, and then theta waves is kind of your creative part. So all those are faster brain waves. But if you're thinking about all those things, sometimes that may be why you can't sleep. And so the magnet, by emitting these slow waves, it captures your brain waves actually and slows them all down, and then you're able to sleep. So if you're having problems with insomnia, we've got solutions for you at our ozone clinic. So again, our ozone clinic is O3 Plus Texas, o3plustx.com. The phone number is 210-558-7778. And some of the things that we will do if you can't sleep, the first one is melatonin. Melatonin is made by your pineal gland, and as you get older, you make a lot less of it. That's probably why people have more trouble sleeping as they get older. And then, so we try that. We have some other natural substances that help you to sleep in different supplements. And if that doesn't work, then we usually will suggest IASIS microcurrent neurofeedback. We talked about that a week or two ago. And what the IASIS does is it reads your brain, sees where the abnormal brain influences, or rather impulses, are coming from, and then gently caresses your brain with delta waves. That's what they think happens anyway. And that helps to calm down your brain. And most people sleep much better after the IASIS treatments. So and again, that's non-drug. And now we have another non-drug thing that can help with your sleep. So now we can loan you a flex pulse magnet, pulsed electromagnetic field magnet, and you can try that under your pillow for a week or two and see if that is able to capture your fast brain waves and bring them all down to slower waves so that you can get some good sleep. Again, good sleep is one of our 5 pillars of good health, and it's extremely important. Okay, so let's see. I think that was all I wanted to say about the freeze. So we had fractures, we had water, and now I'm going to change gears again to something else that we talk about in the ozone clinic, or things that we can do with the ozone clinic, and that is helping your eyes. So, with spring happening, we're going to see all the color. We want to see the colors of the blue bonnets and the green trees when they bud out, the Indian paint brushes, the blossoms on your fruit trees, your roses, and I mean, even just the sun, or maybe a rainbow or anything. But one of the things that happens as we get older is macular degeneration. So you remember we talked about Dr. Velio Bocci, Bocci. So Dr. Bocci was over in Italy and did probably 30 years of research on ozone and wrote a book called Ozone, a New Medical Drug. Now, he actually sent that to the story goes, I will say, because I haven't verified this, but he says he sent the book over to the FDA and said, hey, look at this. I've got a lot of good studies here, and perhaps it should be FDA approved for something. And according to him, nobody ever looked at the book. So maybe that's why ozone is still not FDA approved. I do want to go back to the magnet. So the pulsed electromagnetic field is FDA approved for 3 things, and you'll hear that on the Dr. Oz show that I have the link to. But the 3 things it's approved for is healing fractures, helping to heal fractures, post-operative pain and swelling, and the third one is intractable depression. So with depression, they use a very high frequency magnetic pulsing. The magnet that we have, the flex pulse, only goes up to 1,000 cycles per second. And I'm pretty sure it's higher than that. I think it may be 10,000 cycles per second that you can get treatment for your depression at some of the psychiatrists here in town who do that high frequency pulsed electromagnetic field therapy. But anyway, back to Dr. Bocci. So his book was not accepted by, or at least his research was not accepted by the FDA. But one of the chapters in the book was about the eyes and how he had seen some good benefit in the eyes. So again, I never met him personally, and he died a couple of years ago. But I did meet Dr. Sylvia Menendez Cepero. So I guess it was 5 or 6 years ago, we went to a conference in Cuba. And the reason that Cuba had done so much work on ozone is even Fidel Castro actually had initiated the research into ozone because it was inexpensive and seemed to work for a whole bunch of stuff. So they actually started researching it at that point, and they put a bunch of ozone clinics all over the island. And the main way that they were doing ozone, we talked about different ways of delivering ozone. In our clinic, the main way that we do it is either with major autohemotherapy, where we put an IV in you, we drain a little of your blood into a bag, then we bubble mostly oxygen, 97% medical grade oxygen and 3% ozone that we just made into your blood, and then we put your blood right back into you. So we talked about how that works before. We can go over it another time. But anyway, so that's the type that we use because it seems to be more readily accessible here. However, in Cuba, that, of course, IV therapy is more expensive. And wouldn't it be nice if you can have something that people can do at home? So in Cuba, they did mainly rectal ozone. So that sounds less appealing, but it's not painful at all. So they would have a patient come in, they lie on the table, pull their britches down, and then they put a little tiny urinary catheter in the rectum, and they just push ozone into the rectum. And the ozone is immediately converted into ozonides. Again, those are small molecules that contain that extra electron of the ozone. And then those, because of the blood flow from the rectum, it goes right up to the liver. And that's where it makes those changes. And those ozonides last up to 3 months in the body. So even with one rectal installation of ozone, you can get prolonged benefit. So they were experimenting primarily with rectal ozone, and but then they also did some of their experiments with major autohemotherapy ozone. So what they found was with the rectal ozone, they had a lot of improvement with autoimmune disorders, like people would have rheumatoid arthritis. So they would have them come in 5 days a week, on their way to work. They come in, they slip their pants down, they put ozone in their rectum, and away they go. So it took a whole 5 minutes or less, very inexpensive, and their inflammation markers and their joint inflammation all got better. So that's rheumatoid arthritis. Let's get back to the eyes. So Dr. Menendez, she wrote a book called Advances of Ozone Therapy in Medicine and Dentistry. And this book came out in 2016 and was also written in concert with Dr. Mark Weiser, who's a dentist over in California. So Dr. Weiser was putting on a lot of conferences for dentists and doctors and anyone else who wanted to learn about ozone. And he had Dr. Menendez come in and talk several times. So let's go back to macular degeneration. Why does it happen? And they don't really know everything, but it seems to be multifactorial. It seems to be more in the over 55 group. There is a genetic predisposition. Smoking, it makes it worse. Exposure to sunlight can make it worse. A blue iris, blue-colored eyes make it worse, or you have it more often. If you have hypertension, cardiovascular disease, those could make it be a problem. Low zinc, that could make it worse. High cholesterol, obesity, oxidative stress, other things are associated with increased risk of age-related macular degeneration. And it may be that, those oxidants in there are causing a problem. Emerging evidence indicates that the autofluorescent pigment that accumulates as lipofuscin in the retinal pigment epithelium cells may reach levels that contribute to decline in cell function. That's a quote from this book. So anyway, probably the ophthalmologist, if you're listening, you know a lot more about it. But I want to talk about a study that they had. So this study was that Dr. Bocci had referred to before. And in this study, they had 50 patients with dry age-related macular degeneration, and they compared it to a control group of 30 patients. And they signed consent, of course. And what they did with this particular one was they did the major autohemotherapy twice a week for 12 to 13 sessions altogether. So they took out 250 cc's of blood. They had it anticoagulated. They put in the ozone up from 40 microgram per milliliter or microgram per liter up to, it says microgram per liter. Oh, milligram per liter. Yeah, we use microgram per milliliter. But anyway, so, or some people call it gamma. But anyway, 40 to 70 gamma for each session. So different varying concentrations of the ozone. But basically, then they had it a double blind, and the control group had oxygen. Okay, so they had 250 cc's of oxygen twice a week. So we had oxygen in one group, we had ozone in the other group, and the results showed significant increases in visual acuity of the group treated with ozone, unlike the control group. And these data were confirmed by results from measuring the visual field. There were 54% improvement in the patients treated with ozone and only 18% in the control. And by the test to assess the quality of the vision, 60% increases in vision quality in the ozone group in relation to 23% in the control group. So improvement attained in visual acuity and in visual function in general remained stable for 3 months after the treatment. And then it slightly decreased. So I was very interested in this, at the time that I was hearing about this, all we really had for age-related macular degeneration, the dry macular degeneration, was to take your ocuvites, which are important. I mean, that's part of what they were saying. But then you kind of waited and see what would happen, and we really didn't have any particular treatment. So I had a lady who is the mother of a really good friend of mine, and I said, hey, Mary Lee, how would you like to try some ozone and see if it might help your macular degeneration? And so she agreed, and I'm going to play that audio for you now. And I interviewed her a couple of days ago, and just to kind of see, she's 87 years old, by the way, and here's her story. Today I'm talking with Mary Lee Seal. She's been a patient of my wife's and for many years, and she has had some experiences with ozone helping out her eyes, so we wanted to talk to her a little bit about that. So, Mary Lee, thank you for agreeing to talk, and you agree that this can be on the radio, right?
Yes.
Okay. So tell me, so you started getting ozone about 5 years ago, something like that, when we opened up?
When you started.
Mm-hmm. And what was your eye condition?
I'm trying to remember. I had diagnosed with macular.
Macular degeneration?
Uh-huh.
And was that the dry kind or the wet kind?
Dry.
Dry macular degeneration. Okay, so, your doctor was Dr. Young?
Dr. Young.
And so then did she know that you were getting ozone treatments, or what happened with that?
I think I told her.
Mm-hmm. And then is your macular degeneration getting worse?
Actually, no. When I became wet, and I started going to Dr. Holy.
Okay, so you're seeing
I'm seeing Dr. Holy, and I see Dr. Young once a year.
Okay, so Dr. Holy is a retina specialist?
Right.
Mm-hmm. And she is following, and so you said one eye has wet macular degeneration and one with dry. Okay, and what are they doing?
I get shots in my eye when I need them, and it started out getting them every couple of months, I guess. Mm-hmm. And the last time I went in, it hadn't changed, and it's February in 2019 when I got my last shot in my eye.
Wow, so almost 2 years ago.
Right, and so we're going, right now I'm on a 6 months hiatus from it. Mm-hmm. And I don't really remember when that started. I have an appointment with her to check it again. So
she's just checking you every 6 months and seeing if you need a shot?
That's the way it is. Mm-hmm. Has been this last time. Each time she goes a little bit longer. because I haven't needed one so far. She said, and then I just might not need any more.
So does she think that that's is that the usual progression of macular degeneration?
No, she didn't think so. She definitely thinks it's the ozone.
Okay. Well, that's good. Well, I'm glad you're doing so well. And actually, you're getting an ozone treatment today.
Right.
And you've been getting them about once a week.
Yes.
And these are the major autohemotherapy ozones where we take some blood out and put ozone into your blood and plasma and put it back in you.
Right.
Okay. Are you doing anything else for the macular degeneration? Any eye supplements or anything else like that?
I take the eye medicine.
AREDS vitamins?
AREDS. That's where I take AREDS.
Yeah.
Twice a day.
Okay. And so otherwise, are you pretty physically fit?
Apparently very well.
Good. You said that you had a physical recently?
I had a physical on the 26th of this month, of January. And all of my blood work and everything was better than it had been the year before.
Great. So instead of getting older, you're getting better.
I'm getting better, but I'm feeling older.
Well, at least you have your eyes, and that's really important.
That's very important to me.
All right. Well, thank you for participating here and for sharing your story.
Okay. You're welcome.
Thanks. So that's an interesting case. She's been getting ozone probably weekly for, 4 or 5 years, and her eyes are getting better. And so I guess part of my message here is that I really hope that we can get some studies going to because ozone is not covered by insurance because it's not FDA approved for anything. So, for her to get the ozone, she had to sign a consent form that says she knows that ozone is not designed to treat, cure, or prevent anything. And so she has to pay cash. And but it would be nice, the way that it's more accessible for everybody is if we can get it insurance approved. I mean, who gets these eye problems? It's our older folks. And these are the ones that we really need to be taking the best care of. They have all the wisdom and knowledge, and, we can't just turn them out there and not be taking good care of them. And we don't want them to go blind because that really increases the challenges of taking care of them. So anything we can do to make their eyes better, it would be good. Now, I'm hopeful that in years to come, we're going to have a lot of ozone clinics, that we will have had studies that showed with double-blind, placebo-controlled trials, just kind of like what Dr. Bocci did over there in Italy. We'll compare ozone to oxygen. We can have the patients evaluated by independent ophthalmologists before and after, and let's actually see what goes on here. Did Mrs. Seal just happen to be a lucky one? I've got another patient, and let me see how our time is. Okay. This patient, she had ozone for her eyes as well. And actually, I'm going to tell the story because I don't remember if we recorded this part of it. But basically, she's a registered nurse, and she has macular degeneration as well. And it was just slowly increasing. So as a nurse, she's an ICU nurse, a pediatric ICU nurse. She couldn't really get the IVs in the babies as well as she could before. And also she was worried about whether or not she can continue to be a nurse, because you have to recognize the color changes on a baby. Are they starting to look a little bit blue? Is there anything weird? Are their fingertips blue? Are they jaundiced? So you really have to know the colors and everything. And so anyway, she had come in and she was commenting to me that, it's getting more difficult to do her job. And is there anything that can be done? And I said, well, I'm just learning about this ozone. And they say, Dr. Bocci said in his book that it seems to help macular degeneration. So how would you like to be a guinea pig? And we'll give it a try. And so she gave us consent. And we started doing it. And so the very first time that I did it was in my conventional office. We didn't have the ozone clinic at the time. And she we did a major autohemotherapy on her, and that was on a Monday or a Tuesday, and then she was going to come back Thursday and finish and do a second one. So when she came back, I said, well, what did you think? Did you get any better? And she said, I think I did, but I'm not sure. And I said, okay, well, that's positive. You didn't have any negative effects, right? No bruising or bleeding, because we do use a little bit of a anticoagulant. And she said, no problems. And I actually felt like I had a little more energy. And I said, well, that's all good. So we did the second treatment. And then I called her or talked to her, I guess, early part of the following week. And I said, how are things going? And she says, I did improve. And I said, well, how can you tell? And she says, well, for you ladies who do laundry, you know that one of the challenging parts when you open the dryer is how do you match up your husband's brown, black, and navy socks? And when she opened the dryer door, it was like, oh my gosh, there they all are. Black, black, brown, brown, navy, navy. And she could match up all the socks. And it was just so easy now because she hadn't realized that her visual acuity had declined that much. So I thought that was fascinating. And then she says, and you know, Dr. Frank, what it was after the first session, I didn't really realize it, but you have a black handle on a black door at the office door. And when I was grabbing it before the ozone, I could never tell exactly where that door handle was. So I had to kind of feel around for it and then open the door. And after the first session, when I went out, so this was even right after the ozone treatment, she could see enough of a shadow around the door handle that she could grab it confidently. And then when she walked down the steps of our office, she could see the shadows of the steps, which she couldn't see before. And so she was more confidently going down the steps of the office after the first treatment. Now, so I was all excited about that. So we were continuing to do weekly or twice a week treatments of her eyes. And then they went on a family trip and had to visit some relatives and different things. So I don't think she got the ozone for about a month or 6 weeks. And all of a sudden she had a decline. And we never quite got that benefit back again. So that is the part that I feel like we need a lot more research on. You know, it's obvious that the ozone seems to be helping. We have one double-blind trial that Dr. Bocci did. We need to do more studies and see. And then more than that, we need to see how, once you get a benefit, if you get one, how do you maintain it? You know, is there something else that we can be doing? There are some practitioners who feel like chelation, which is getting rid of heavy metals out of your bloodstream. Combine that with the major autohemotherapy might help. And, you know, the other thing would be, what about the rectal ozone that they were doing in Cuba? I mean, I know it sounds kind of gross, but it's very easy to do. I've done it before. And the advantage of it is you can do it in your own home. If we help you, we teach you how to do it. You get an ozone generator. You have to have an oxygen tank. But I mean, it takes a whole 3 minutes, maybe 5 minutes. So it doesn't get in the way of your workday. You can do it 5 days a week and off on the weekends. Like most things, you don't want to do ozone every single day. The body gets used to things, and you know, the reason that ozone seems to work is you're kicking your body's antioxidant enzyme systems up by giving it a low dose of an oxidant. So a controlled dose. That's why ozone is safe in this method. You know, you have to, anytime you're using anything, you got to know the right dose and the right application of it. I mean, just like water, if you pour water down your lungs, it's not good. But if you drink it, it's good. If you drink too much water, it's not good. You dilute out your electrolytes. And so even water has to have a safe dose. Ozone's the same way. That's why we need to train you if you're ever going to do ozone at home. Rectal ozone would be the main one. But if you're doing the blood ozone, we don't recommend anybody do that at home. We've been to 6 years now of training. We know how to do it safely, and that's the key. So again, how do we know how to do this? Where do we know how to do this? That's at our ozone clinic, o3plustx.com. O3 Plus is our Health and Wellness Clinic here in San Antonio, Texas. The phone number is 210-558-7778. So the things we talked about today that we might be able to help you with, one of them would be the vibration plate. If you want to experience the benefit of having more easy water, that's that type of water that stimulates your mitochondria, come on in and we can get you on the power plate, and you can experience that and see if that might be something you want to get for your house. We can also show you the infrared sauna, and you can see if that may be something that you want to buy for your home and get the benefits of that, or take a walk in the sunlight and get more easy water from that. The second thing we talked about was the magnet. And so we talked about the pulsed electromagnetic field, how it can help heal fractures in up to half the time. That one is FDA approved for postoperative pain and swelling and healing of fractures and intractable depression. Our machine is not recommended for intractable depression, but it is qualified to treat the fractures and postoperative pain and swelling. Of course, you got to check all that out with your surgeon, your doctor, make sure everything's okay there. I'm not going to be your physician. I'm giving you ideas to talk over with your physician. And then when we can help you, you give us a call at 210-558-7778 and talk to Terry. She'll get you hooked up with our nurse practitioner, Kim Engelman, who will do a full assessment because we have to make sure everything is done safely. You'll sign a consent form that says you know that ozone is not FDA approved to do anything, and then we'll do something. So again, and then the other thing that the pulsed electromagnetic field could maybe do is help you with sleep. And if you're still having troubles with sleep, we talked about the IASIS microcurrent neurofeedback that we can do in the clinic. That can help for a lot of things, post-traumatic stress syndrome, traumatic brain injury. Believe it or not, it helps with autism as well. Seems to. There's a lot. We'll have a whole another session on autism sometime to try to figure out why we have so much autism in the country now. But it's nice to know there are some things that help it. And then we went into the benefits of ozone for your eyes, so you can see all the beauties of springtime coming out. If you can keep your eyes from degenerating with age-related macular degeneration, that would be a beautiful thing. We have some preliminary studies that look positive. It's not FDA approved for that, but we can guide you along the way at our ozone clinic too. And you can, what I would love is if you go get an eye checkup from your ophthalmologist or optometrist first, and then we do some treatments on you. And then you go back and see how it went. I mean, that's the way we're going to find out. Those are, anecdotal observational studies. They're not near as good as double-blind placebo-controlled trials, and they will not get us FDA approved, and it won't help us to get insurance approval either. But anyway, that's my mission with this radio show is hopefully in 5 years, everything will be covered under insurance, but we'll have to see how it goes. So that's wrapping up our show today. I really appreciate you being with us. Again, this is Dr. Frank Cutting Edge Medicine. If you go to drfrank.com, drfrank cuttingedgemedicine.com, we'll have all the links for the things that we talked about on the show today. And again, this is sponsored by O3PlusTX.com, O3PlusTexas.com, our ozone clinic. Wishing you a great week of increasing health, wellness, and longevity. Have a great week, and we'll see you next time. Thank you.
Native Americans, which include American Indians and Alaskan Natives, have a greater chance of having diabetes than any other racial group in the United States. Diabetes is the leading cause of kidney failure, a serious condition that can be disabling and requires dialysis or kidney transplant for survival. Kidney failure can be delayed or prevented with good diabetes care, patient education, and kidney testing. Using these approaches, new cases of kidney failure from diabetes dropped by more than half in Native Americans between 1996 and 2013. If you have diabetes, check your blood pressure and blood sugar regularly and keep them under control. Take your medications as directed. Reduce your salt intake and talk to your healthcare provider about having your kidneys tested. To learn more, visit cdc.gov/vital signs.
CureSearch.org is a website that can help. It connects you to the doctors and scientists whose collaborative research has turned childhood cancer from a nearly incurable disease to one with an overall cure rate of 78%. CureSearch.org. You're not as alone as you feel.